Hello, I'm Andrew Hales. I'm here with Jane.
Hi, Andrew.
Thank you so much for being here.
Thank you.
Yeah, you're a ketamine user.
You could say that, yes.
Therapeutically.
Yes.
Okay, let's go from the beginning. You were in a car accident?
No, I had a traumatic brain injury December 2017. It wasn't a car accident. It was a different type of accident, but it resulted in a bleed in my brain, as well as PTSD and super bad anxiety and chronic pain.
Wait. What kind of accident?
I was a victim of a violent crime.
Okay.
And I don't remember exactly what happened to me. I woke up on the concrete, like the ground, twice. So I had damage to my frontal lobe, and I think it's like the sub-occipital lobe in the back. They did a CT a couple days after my injury, and the CT missed, or the ER missed the bleed in the back of my head. It could have been too small at the time, or they were very dismissive of it, and they miss about 20% of bleeds in the ER, when especially when you say that there's not a big story behind it. They don't take it very seriously. And the story I'd given them at the time was just that I had hit my head on the coffee table.
Okay.
So they had missed the original bleed, and so I went untreated after that until mid-February of 2018.
Right. Okay. So a couple months goes. You're having these awful symptoms, whatever. What kind of symptoms?
Well, while I was untreated, I'd say the worst part was the anxiety, like extreme panic attacks, to the point where I would be thinking I need to go to the ER because I was having a heart attack, and I'd be paranoid out of my mind everywhere I went. My heart rate was arresting like 140, 160. I'd see it up at 180 while I was resting, which was very abnormal for me, and I was losing a lot of weight at the time while I was still eating pretty normally. And I was also very emotional, since I had a frontal lobe injury. I didn't know at the time, but I started having symptoms that my mother actually thought meant I was developing schizophrenia, and so I was seeing my psychiatrist and like trying to figure out what other mental issues could be going on, because I was acting not like myself at all. I failed all of my finals right after getting into NYU because I couldn't finish them in time. I needed to be sleeping like way more than normal, and it was very hard to wake me up. My memory was like almost non-existent. I wouldn't remember an hour before. I wouldn't remember doctors' faces, doctors' names, really anything. So.
Okay.
And my speech was also affected, and my driving. I couldn't drive anymore because my eyes, they did what happens when you drink and drive, and that eye test, I would fail if they did that to me, because my eyes, they jumped.
Like at any point in the day?
Yeah.
All right.
Because of the brain injury.
So finally in February, you found a doctor that treated you?
Yeah, so mid-February, my ex and I split, and right after that, I told my mom that something else had happened to my head, something more severe than what I told her before, and that I was scared, because within the, I'd say 6 to 7 weeks before telling my mom the truth, I had been getting worse and worse, brain injury-wise, and I was really scared for my life at the time, because I thought it was just a concussion, because I thought the CT said there was no bleed, and concussions over time get better, not worse. And over that time, I was getting significantly worse and worse and worse, and unstable in every single way, really, constantly shaking, and just in extreme, extreme pain, like in my neck, and I couldn't really function anymore without having to take Xanax and Valium, and we tried muscle relaxants and lots of other medications to try and keep me normal, to keep me like a normal person, and I never needed those things before.
Yeah.
But
okay.
That's kind of how I was before.
February, they start figuring out
so I started
all this shit.
Yeah, I see a few doctors, several.
Yeah, several doctors.
Yeah, because I was in pain throughout my whole body, and we saw a couple different types of neurologists. So I saw like a functional neurologist who I saw several times a week. I can't remember his name or face, but I saw him from like February through May when I left Oregon. But I saw him a lot regularly, but I also saw a neurosurgeon, a psychiatrist, or some type of neurosurgeon who had imaging done, and she's the one who found that there was the bleed. But by the time she found it, it was already resolving itself.
So, okay, good. So at that point, the bleed was not an issue.
Yeah, it was still problematic. Like, I still had symptoms, but it was getting smaller on its own, which with the type of bleed I had, it was a subarachnoid hemorrhage in the back, which is bleeding between the brain and the brain tissue. Okay. And so that meant really, it was the first month of January that mattered more than anything, because that first month kind of had a 55, I think, % chance of me surviving with the brain bleed untreated. So after that, it was kind of cleared as, okay, I'm safe, I'm fine, I'm recovering.
But wait, but back in January, they didn't even know there's a bleed?
No, they didn't know, because the bleed was just getting worse at that time. And with people who also get that type of bleed, the statistics are about 50-50.
Wow.
Yeah.
Valium, Xanax, whatever, and then something still was off. You're still having symptoms.
Yeah, so it kind of got so bad to the point where my doctors in Oregon were like, your PTSD here is too severe for your brain to like fully recover, if it will. I can't be in that panicking state all the time for my brain to physically heal. And so they were like, it'd be best if I had moved to somewhere where I felt safer. And so I moved to Austin, where they also had really great medical care for me. And a really close family friend who was back in medical school there, who knew me very well and could be there for me medically, because I was going to be on my own out there. And then also one of my best friends and his family lived there, so I had support there. So
this whole last year has been a break because of this accident, break from school, break from everything.
Yeah.
Just trying to get situated.
Yeah, kind of, yeah.
Okay.
So it wasn't until August that I was released from neurology and cardiology. So
in Austin?
Yeah.
When did you start doing ketamine?
So
how did that come about? So, the doctor was just like, hey, we
No, it was, so I had been to the ER or urgent care like several times from extreme muscle spasms and all this chronic pain that I was always in, to the point where I couldn't work. It started happening in Oregon, really. Like, I couldn't get out of bed because of it. Or in Austin, when I finally got my first job since my brain injury, a weekend, my doctors said I couldn't work anymore because of the pain I was in, just from I worked at Brandy Melville, like a store, and just like, I was on my feet and sitting down for 4 hours. Like, that movement itself was too much, and the pain was too severe, and I'd wake up in like excruciating pain, where like I'd have to go to the ER, and muscles would be spasming so bad that you could see physically like my spine being pulled and curved to the side from muscle spasms.
Wow.
And so we couldn't figure out the cause of this pain anymore, because it had been a long time since the injuries.
Yeah.
I'd been doing physical therapy as well throughout all of this, and I've had imaging, like MRIs and x-rays of basically my whole body at this point. They can't find a physical reason that is big enough to explain the amount of pain that I'm in. And so at that point, where we looked into other types of therapy, I myself had come across on YouTube someone telling their story about ketamine infusion therapy for their depression and chronic pain. And so I texted my mom about it, who's a medical professional, and she's like, I actually was just talking to someone about this too, and I think we should look into it. And so my mom did a lot of research on it, and I did a lot of research on it myself, and we found a doctor here who, at a surgery center. In
LA?
Yeah, in LA.
Okay.
He does all types of pain management, so he doesn't just do ketamine treatments for people. He evaluates them and decides whether I would be a good person for that treatment. And so I went in, I told him everything about me, my story, my physical like history and all of my problems, and we decided that trying ketamine infusion therapy would be very beneficial to me. So I was kind of seeing him for 2 reasons, because ketamine can be used at low doses for chronic pain and depression and PTSD, along with a ton of other issues.
What was your use, I guess, if you had to put a title on it? Pain?
Yeah, so I was there for depression, PTSD, and chronic pain, so my situation is a little bit more different than a lot of people who would go in for ketamine infusion therapy sessions, because I needed a higher dose than the people who are there just for mental illnesses.
Okay.
Because the chronic pain is a little bit deeper, and it's changing the like neural pathways in my brain. And I also, due to my genetic testing and stuff, my opioid receptors don't respond as strongly as someone else's would. So. Yeah.
Did you try painkillers?
Yes. Opioids don't work well with me.
Wow. And
I also don't want to be on them at all. Like I do everything to avoid them, really.
Yeah, no one wants to be on anything.
Yeah, the goal is not to be on medications.
Yeah.
So, and like I'd tried 1 million medications by now. So.
Okay.
I did not want to be put on opioids of any kind, and it was kind of like, well, ketamine treatments, they're not a long-term thing where I'm going to have to be taking a pill every single day.
Okay.
It's physically changing my brain and how it works, with, which I really liked the idea of.
Okay, so you started them in October?
I think November is when I started.
So the first time you took it, what's it feel like?
So the first time, I was really nervous because it was kind of last minute. My mom was visiting me because I like to have her there for most of my appointments, like doctor's appointments, because I don't really remember my own medical history as well as she does. So we met with the doctor, and he actually offered to have me start that day, which kind of freaked me out, because I was like, wow, ketamine, I had all these like different connotations in my brain about it. Like I'd heard about it, like
club drugs.
Yeah, like
Special K.
It's highly abused. It's also an anesthetic used.
I've heard it's a date rape drug.
Yeah, it is.
Even?
It is, and it's used on animals. Vets use it all the time.
Oh yeah, duh. Horse tranquilizer.
Yeah, like
duh.
It has all types of.
Yeah.
So when I was a little like scared of it, and then for him to be like, oh, can you come back in a couple hours and start yours? I was a little bit kind of freaking out. And I took it really well the first day. He was surprised by how well I was able to handle the medication.
Okay.
And
what did it feel like?
What's really weird about ketamine is that when you are on ketamine, it's a dissociation feeling. So so like I kind of felt like I'm in a different world. And
I've heard it's like, it's very dreamy.
Yeah, so I put in headphones and I listen to music during it. Or else you're going to be in there for hours and bored in a dark room. And basically, I kind of just see things, like it seems like I'm in a different universe. There's no words to describe what it's really like being on ketamine.
Yeah.
It's kind of, you can't really tell if you're dead or alive, but at the same time, you're comfortable and not afraid. It's like a very, I haven't done any like
That sounds like crazy.
No, it really is.
It sounds like DMT kind of.
I haven't tried anything really else similar to.
Have you done any psychedelics?
No, I haven't.
All right.
And I was actually kind of afraid that those kind of effects that can happen with ketamine would occur to me, and with PTSD
that
can
make me
be
scared.
Yeah, and I've never tried any, and so with having PTSD, that thought of possibly having like psychedelic effects with PTSD could be really scary. But I had no problems with that. I felt completely relaxed and happy.
So you liked it?
It was comfortable. I did not enjoy the needle in my arm. That's kind of one of my biggest fears, and I hated that.
So then you're out of there, and you feel kind of good. You feel relieved.
Yeah. Immediately I had no pain, which was great, and always starving because I can't eat before, so I'm always getting food and in a good mood because of that, and kind of a little out of it.
Fun.
Which is good, but I'm just in a better mood overall. Like I don't feel as like heavy,
of course,
if that makes sense.
Sure, yeah.
But the pain I noticed had decreased significantly in my like neck, which was a place that was a huge issue for me.
How often do you have to do it now?
So, now...
Or have you been doing it? Yeah.
So I did it I did either I think it was like 6 or 7 sessions initially, which were a few times a week. So I did it for a few weeks, like going in, and then I felt some relief, and then I went back in January for a follow-up because I was having more pain and more problems, but it was also because of the time of year, being 1 year since the incident, and my PTSD was really bad because of other reasons. And so things like in my life were a little worse than normal. And so I went back in for a follow-up session, and he did a normal ketamine infusion on me. And then he also prescribed me ketamine nasal spray for me to start doing on my own at home, which is not as common. It's for patients who struggle with the pain the worst, I'd say. Maybe depression too. That's not my main reason. Mine was more the PTSD. Depression was like a good thing about the ketamine stuff, but the pain is what I really cared about. And so I was prescribed a little like squirt bottle that I squirt up my nose for me to do every 6 hours is what the bottle says, but it's also used for like as needed. Can
you overdose on it?
So I'm given like a fraction of what they'd give you for anesthetics.
Okay.
The dosing like varies very, very widely.
How much does like a clubber?
I honestly don't like even know, but they take really, really, really high doses for the people who go into K-holes. You have to take a lot to go into a K-hole.
Have you gone into a K-hole?
I think, well,
what's a K-hole?
It's hard to say. So I don't even know how to describe one. They're just when you're in a completely different universe. They're how I've been described, like, sorry. How people have described K-holes to me, like, or what I've seen online is they're the person at the club who's like on the ground sitting, like staring at the floor, like just like kind of like they look dead. They're like in their own thing.
Yeah.
I think to be fully in a K-hole, you'd need way more than what I was ever given, but I was definitely given enough for me to feel the dissociation effects where it felt like I'm in a different reality and walls are moving and I was having thoughts and realizations, and it's kind of like a spiritual thing. Like I had a whole like experience which kind of felt like what I'd imagine a K-hole would be like, but based on like the research I've done, the amount that people do recreationally, clubbing, not all people, but like the people who are really addicted or really into the drug, they take way, way, way more than what I was ever given.
So yeah, huge controversy with the opioid crisis, you know, people getting addicted. Do you feel like you're addicted to ketamine?
No, so ketamine is actually, even though it interacts with like your opioid receivers, or my terminology is probably wrong, but
yeah,
it interacts with like that part of your brain, just like other opioids do, but it's not an opioid, I don't believe. It has similar effects of opioids, but it doesn't have the negatives, the addiction parts and the dangerous parts of it. So it doesn't prevent any of the functions that my body has from keeping me alive, like with my respiratory system and stuff like that. And it's not addictive physically. People who abuse it could have an addiction to the dissociation feeling, due to other mental illnesses probably, and so they're searching for an escape, just like alcoholism. But it's not an addictive drug, and it's a very, very safe drug. Like, it's given to kids on ambulances at age like 12. It's very, very safe, and it's been used for years.
Do you think you'll taper off the nasal?
Yeah. I can stop it at any time. There's no withdrawal with ketamine because there's no like physical part of ketamine that's addictive, and I don't do enough of it to even get like the dissociation addiction.
Good. So you're kind of like recovered, like recovering.
Yeah.
You're there.
Yeah, but the infusions are very exhausting, I'd say, just with the whole, because with the nasal spray, I don't get the dissociation effects as much. I get the relief from the pain and kind of like feeling happier and like lighter, and some other like positive effects of the ketamine, but I don't have like the full like going into a different, feeling like I'm in a different reality, which is kind of, can be scary, but also just really exhausting mentally.
The infusions are supposed to rewire.
Yeah, that's like how I say it. Yeah,
like a permanent thing.
Yeah.
Wow.
Yeah. They can't. It hasn't been used for this long enough to say that it's really permanent. But the people that have been doing it have seen long-term effects that are very beneficial, permanent for some, as for now.
I've heard it's not FDA approved.
Yes, so it's actually, well, the drug itself is, but not for this purpose.
Right.
Because
so
it's
yeah. So do you have to pay out of pocket?
Yeah, so that's why I think that it's not as common as antidepressants or other solutions for depression.
It's pricey.
And stuff are. It's a very expensive treatment, and but it's kind of, I think it's kind of a miracle drug, and I think that at some point it will be approved for this because its effects are very significant, and the statistics are like amazing, and for me it's helped a lot, even as I've continued to go through other traumatic things. And I think that if it was accessible to everybody, it would take most people off antidepressants altogether.
Really?
Yeah, because ketamine, it's kind of like a substitute for it. At least it can be used for one. So instead of taking a pill every day, you go get these sessions done for a few weeks or a couple weeks. Most people don't need this nasal spray. And then you feel good. You don't feel depressed, and you don't have that suicidal tendency anymore, from all the research I've done on it, which is extensive because I was really scared of it before going in there.
Please let us know what you think about all of this in the comments. Any stories you have with people you may know that take ketamine for therapy, or if you took ketamine once. Check out Jane's Instagram. Your main Jane. Okay. That's it. I'll list that. Blow that shit up. And I'll see you next week. Thanks for watching.